Hello, I'm Professor Peraza, and today's lecture video covers alcohol. These are the specific learning objectives for this module. This module also meets the following course learning objectives. For this lecture, this free textbook is your primary reference material. More information, including page numbers for readings, can be found in the Canvas course space for this module. Let's first start with what alcohol is. According to the World Health Organization, alcohol and alcoholic beverages contain ethanol, which is a psychoactive and toxic substance with dependence-producing properties. A psychoactive drug is any substance that crosses the blood-brain barrier, primarily affecting the functioning of the brain, be it altering mood, thinking, memory, motor control, or behavior. Alcohol in chemistry refers to a group of similar organic compounds, but in beverages, the only alcohol consumed is ethanol. Alcohol can be made from a variety of different starch foods through the process called fermentation. Fermentation of a starchy food such as barley or wheat can produce ethanol and CO2, which makes up what is commonly known as beer. The recommendations for alcohol consumption vary slightly between the 2020 and 2025 guidelines. However, the general theme is the same. Let's explore this more. The 2020 DGAs say limit foods and beverages higher in added sugars, saturated fat, and sodium, and limit alcoholic beverages. It is noted that adults of legal drinking age can choose not to drink or to drink in moderation by limiting intake to 2 drinks or less in a day for men and 1 drink or less in a day for women. It is also noted that drinking less is better for health than drinking more, and that those who do not already consume alcohol do not start drinking alcohol. The 2025 DGAs say limit alcoholic beverages. They further go on to note that individuals should consume less alcohol for better overall health. While the current DGAs do not have a specific target for drinking less, the CDC website still notes the same recommendations as the 2020 DGAs. The American Heart Association also reinforces that individuals who don't drink alcohol should not start. They also note alcohol should be limited and any moderate use discussed with one's healthcare provider. It is also important to note that 1 drink is defined as a standard drink of alcohol, which is 14 grams or 1.2 tablespoons of pure alcohol. Often, alcoholic beverages can have more than a standard drink of alcohol. Now, I noted moderate drinking, and I want to cover other terms such as excessive alcohol use. As a reminder, moderate drinking is defined as 2 drinks or less in a day for men and 1 drink or less in a day for women. The CDC identifies 4 behaviors under the category of excessive alcohol use as binge drinking, heavy drinking, underage drinking, and drinking while pregnant. Binge drinking is defined as 4 or more drinks for women or 5 or more drinks for men during an occasion. Heavy drinking is defined as 8 or more drinks for women or 15 or more drinks for men during a week. Underage drinking would be any alcohol use by people younger than 21. Drinking while pregnant is any alcohol used during pregnancy. I've alluded to a few individuals who should not drink alcohol, but let's explore this more. Those who should avoid alcohol include those under the legal age for drinking, individuals who are pregnant or might be pregnant, those with medical conditions or those taking medications in which alcohol can interact, those recovering from alcohol use disorder, and individuals who are unable to control the amount they drink. We are going to talk more about the effects of drinking during pregnancy, but first I wanted to just mention breastfeeding and alcohol consumption. The safest option for those who are breastfeeding or pumping and feeding expressed milk is to avoid alcohol consumption. As long as alcohol is in the mother's bloodstream, alcohol will be present in breast milk. Alcohol levels are the highest in breast milk about 30 to 60 minutes after consumption and can be detected for about 2 to 3 hours after just 1 drink. Food consumption also delays peak milk alcohol levels. This length of time continues to increase with continued consumption of alcohol. The NIH also notes that if someone is casually drinking while breastfeeding, consuming 1 standard drink, it is best to wait 2 to 2.5 hours before nursing again. This is per drink though. So if more than one drink is consumed, that time would be increased. Overall alcohol consumption while breastfeeding can lead to decreased milk production, shortened breastfeeding duration, meaning less milk intake from the infant agitation, and poor sleep patterns. The long-term effects of daily use of alcohol on infant development are unclear. Again, ideally, it is best to avoid alcohol as the safest option. Let's talk about alcohol and pregnancy. The overarching message is that there is no safe amount or type of alcohol use during pregnancy. Also, if someone is trying to get pregnant, abstaining from alcohol is also recommended, as most individuals do not know they are pregnant until 4 to 6 weeks after conceiving. Alcohol readily crosses the placenta, with fetal blood alcohol levels approaching maternal levels within 2 hours of maternal intake. Any amount of alcohol, including consumption under the moderate category, can negatively impact the baby. Alcohol use during pregnancy is a leading preventable cause of birth defects and developmental disabilities in the United States. Fetal alcohol spectrum disorders, FASDs, refers to the group of conditions that include physical, behavioral, and cognitive impairments occurring due to alcohol exposure before birth. These are 100% preventable with alcohol abstinence. One of the most severe outcomes is fetal alcohol syndrome, FAS. FAS is associated with reduced intelligence, attention disorders, neuropsychological deficits, physical abnormalities, including facial dysmorphology, sleep disorders, and behavioral problems. Those affected by FAS might have abnormal facial features, growth problems, central nervous system abnormalities, and difficulties with learning, memory, attention span, communication, vision, or hearing. Alcohol-related neurodevelopmental disorder can also occur, which leads to intellectual disabilities and issues with behavior and learning. Individuals often have difficulty with math, memory, attention, judgment, and poor impulse control. Alcohol-related birth defects can include structural abnormalities of the heart, kidneys, and bones. Fetal alcohol spectrum disorders are irreversible, though early intervention can help improve outcomes. Outside of fetal alcohol spectrum disorders, other adverse health effects associated with alcohol use in pregnancy include miscarriage, preterm labor, intrauterine growth restriction, and stillbirth. Before we talk more about the negative effects of alcohol consumption, I want to review alcohol metabolism. Alcohol is metabolized by several processes or pathways. The most common of these pathways involves two enzymes, alcohol dehydrogenase, ADH, and aldehyde dehydrogenase, ALDH. These enzymes help break apart the alcohol molecule, making it possible to eliminate from the body. ADH metabolizes alcohol to acetaldehyde, a highly toxic substance and known carcinogen. Acetaldehyde is further metabolized by ALDH to another less active byproduct called acetate, which is then broken down into water and carbon dioxide for easy elimination. The primary site of metabolism for alcohol is the liver, though some alcohol metabolism occurs in the pancreas, brain, and GI tract, leading to damage to cells and tissues due to the acetaldehyde. In addition to ADH, ethanol can be oxidized by a microsomal ethanol oxidizing system, MEOS, which is utilized with moderate drinking and also chronic and heavy drinking periods. Heavy drinking stimulates the human body to include the MEOS system enzymes to clear ethanol faster from the body. The MEOS system is also located in the liver. Similar to the alcohol dehydrogenase system, acetaldehyde dehydrogenase will immediately convert acetaldehyde into acetate, non-toxic molecule. Other products from this reaction are NADH and H+ ions. Because the system is also one that is utilized to metabolize different medications, excessive drinking can increase the risk for drug interactions and toxicities. Let's talk more about concerns and risks with alcohol use. Alcohol is absorbed quickly into multiple body organs, and it influences the nervous system, including the brain. It also affects the circulatory system, slows digestion if consumed with food, and interferes with numerous medications. Drinking too much alcohol can lead to an increased risk of death from all causes. High alcohol consumption can increase the risk of high blood pressure, stroke, cancer, liver disease, cardiovascular disease, depression, suicide, injuries, and alcohol use disorders. The risk of certain cancers is increased by chronic alcohol use, including breast, esophageal, oral cavity, pharyngeal, liver, colorectal, gastric, and pancreatic. Drinking any alcoholic beverages, including red and white wine, beer, and liquor, is linked with cancer. Chronic alcohol use impairs bone health, leading to osteoporosis. Alcohol impairs the function of B and T cells, thereby increasing the risk of both bacterial and viral infection. In addition, alcohol increases the risk of injuries and STDs. Although many of these health risks are noted with increased alcohol consumption, even moderate drinking has its concerns. While some research previously suggested moderate drinking to be good for health, this is widely debated since newer research notes that there aren't health benefits of moderate drinking compared to not drinking. Many past studies did not consider other factors like genetics or healthful behaviors that could have influenced the results. Now, I do want to mention red wine since this is often touted as being beneficial for health. This is very debated now. Again, if we go back to the recommendations, not drinking at all is better for health than drinking. Some studies have shown a modest reduction in heart disease risk with red wine consumption, while other studies found no significant effects or even potentially harm with consumption. It is critical to note that research has not consistently supported a cause and effect link between drinking alcohol and better heart health. A lot of the issue with the research is that it's not clear whether it was the wine or other factors truly leading to benefits, as individuals who are moderately drinking wine may also be living a healthier lifestyle, including a healthy diet and physical activity. A review noted that red wine drinkers tended to eat aligned with nutritional guidelines and have a healthier attitude. With red wine, though, the benefits are primarily attributed to flavonoids and other antioxidants, as they can potentially reduce the risk of heart disease. Dietary polyphenols have been shown to be beneficial for metabolic syndrome, cancer, and neurodegenerative diseases. Flavonoids, such as with berries, are associated with a reduced risk of mortality, along with antioxidant and anti-inflammatory capacities. Additionally, all the components I noted, such as polyphenols and flavonoids, can be found in spices and herbs, cocoa, berries, seeds such as flaxseed, nuts such as hazelnuts, olives, and some vegetables such as artichoke. These foods can be consumed without the risks associated with alcohol consumption. While many still promote alcohol consumption for heart health, research shows that alcohol consumption at any intake can increase the risk of cardiovascular disease. Specifically, alcohol is associated with atrial fibrillation, hypertension, cardiomyopathy, coronary artery disease, and type 2 diabetes. Chronic excessive alcohol consumption can lead to alcoholic cardiomyopathy and hypertension. It also influences lipid metabolism, inflammation, and insulin resistance, increasing the risk of coronary artery disease and diabetes. High concentrations of alcohol trigger oxidative and cardiotoxic mechanisms in cells, causing the cardiomyopathy, arrhythmias, and heart failure. It is not recommended to use alcohol as a primary or secondary intervention for cardiovascular diseases. I want to discuss the effects of alcohol in the liver more in detail. Alcohol-associated liver disease usually occurs over a period of time in individuals who drink excessively. There are a variety of disorders and manifestations within alcohol-associated or alcohol-related liver disease. The first stage is alcoholic fatty liver, or steatosis. At this stage, fat begins to accumulate in the liver. This stage is reversible if the individual abstains from alcohol. The next stage is alcoholic hepatitis, where the liver cells become inflamed. There may or may not be symptoms, and if there are, it can include vomiting, jaundice, fever, and pain. This stage is also reversible if the individual abstains from alcohol permanently. The outcome does depend on how severe the damage is, though. Outside of abstinence, nutritional support is warranted, along with treatment for any infections and medications in certain cases. Unfortunately, more severe cases lead to liver failure. The final stage is alcoholic cirrhosis, where the liver becomes significantly scarred and the liver cells lose their function. Alcoholic cirrhosis is the stage described by progressive hepatic fibrosis and nodules. This stage is generally not reversible. Abstinence from alcohol is crucial to stop any further damage. There are a lot of factors that influence the development and progression of alcohol-associated liver disease, including genetics, pre-existing conditions, and nutrition. Treatment and management will depend on the extent of the disease, and as I noted before, all stages involve abstaining from alcohol use. Additionally, nutrition support is recommended with a dietitian to ensure adequate calories and nutrient intake, especially since malnutrition is common. We have talked about the changes that can occur with excessive alcohol consumption, and I want to cover alcohol use disorder, or AUD. AUD is a medical condition that ranges from mild to severe and has multiple criteria for diagnosis, including indicators such as withdrawal symptoms and tolerance. The DSM-5 says that it is a problematic pattern of alcohol use leading to clinically significant impairment or distress. AUD is a chronic disease with significant medical, social, and psychological implications. The etiology for AUD includes genetic and environmental factors. Environmental factors that increase the risk include external stress, mental health conditions like depression, anxiety, and PTSD, heavy drinking, and age of onset drinking, with those who started drinking in adolescence at a higher risk for AUD. Complications of AUD include periodontal disease, GERD, gastritis, pancreatitis, cirrhosis, stroke, atrial fibrillation, hypertension, sleep apnea, aspiration, bacterial pneumonia, osteoporosis, dementia, anemia, hepatitis, neuropathy, immunosuppression, and coronary artery disease. Additional complications include malabsorption, nutritional deficiencies, and Wernicke-Korsakoff syndrome, which we will be covering next. Treatment includes medications and behavioral therapy such as CBT, 12-step, or mindfulness. Last thing we will cover are the micronutrients associated with excessive alcohol consumption. We will go over the micronutrients more in detail when we get to the micronutrients module. We will discuss more about toxicity and deficiency then. Alcohol consumption can lead to not only more nutrients being lost in the urine, but poor absorption and storage of micronutrients. All the B vitamins can be impacted by alcohol, but I'm going to just mention a few of them today. Vitamin B1 deficiency is linked directly to Wernicke-Korsakoff syndrome and associated brain atrophy. B1 deficiency can also produce certain cardiovascular, psychiatric, and neurological complications. Alcohol inhibits intestinal vitamin B2 or riboflavin absorption, and deficiency can include angular stomatitis, cracks or fissures at the corners of the mouth, glossitis, inflamed, smooth, magenta-colored tongue, and chiliosis, dryness, scaling, fissuring, and cracking of the lips. Ethanol also affects intestinal vitamin B9 absorption, or folate, essential for DNA synthesis, red blood cell formation, and cellular metabolism. Alcohol inhibits fat absorption and impairs absorption of the fat-soluble vitamins A, E, D, and K. Vitamin A deficiency can be associated with night blindness. Vitamin D deficiency is associated with softening of the bones. Vitamin K is needed for blood clotting. Vitamin C deficiency can lead to scurvy with petechia. Zinc, magnesium, selenium, folate, and omega-3 deficiencies have been documented to trigger negative emotional states. Magnesium deficiency can result in insulin resistance and muscle cramps. Selenium deficiency can lead to cardiomyopathy. Mineral deficiencies in particular tend to be secondary to alcohol-related problems like decreased calcium absorption due to fat malabsorption or iron deficiency related to GI bleeding. Heavy drinking can also lead to a decreased absorption of amino acids, peptides, lipids, glucose, and water.